Have you ever wondered if a stubborn it could be more than just dry skin or passing irritation? Most people shrug off the occasional itch, but for those over 60, certain itchy, what about spots on the body? Could be your body's quiet cry for attention, warning signs, something far more serious beneath the surface. In today's video, we're diving into 5 highly specific areas of the body where persistent itching may signal the presence of cancer, often long before any other symptoms begin to show. These aren't just random itches. They're patterns that medical professionals have consistently observed in patients. Later, diagnosed with conditions like lymphoma, pancreatic cancer, breast cancer, and even skin cancers. Stick with me to the end, because this isn't just a list of body parts. We'll uncover the hidden science behind each of these warning signs, why certain areas itch, what types of cancer they're associated with, and how to recognize the difference between a harmless irritation and a red flag your body wants you to notice. By the time we're done, you'll be equipped to spot the signs early, ask your doctor the right questions, and take smart, proactive steps before a small issue becomes something much harder to treat. And remember, this video isn't meant to spark fear. It's meant to spark awareness, because the sooner you notice the signs, the better chance you have at staying ahead of them. Let's get started. Sign 5, persistent itching in the anal or genital area. There are a few things more uncomfortable and more often ignored than itching in anal or genital region. It's an awkward subject, especially for older adults, and many people would rather brush it off than bring it up. But when this type of itching becomes chronic with no obvious cause like hygiene, infection, or irritation, it may be trying to draw your attention to something far more serious. In some cases, persistent itching, this area can be a quiet early symptom of anal, vulvar, or even penile cancer. What makes this kind of itch dangerous is that it often disguises itself as something minor. People assume it's just dry skin or reaction to toilet paper, a bit of friction from walking, or even a side effect of incontinence pads. And in many cases it is, but when it lingers for weeks or months, when it returns, no matter how much you clean, treat, or moisturize, and when it begins to feel more raw or burning than surface level, it deserves a closer look. There was a man named Lewis, 76, who had been dealing with what he thought was hemorrhoid irritation for almost a year. Used creams, changed his diet, even tried cold compresses, but the itching never fully went away. Eventually, a colorectal specialist ran a scope exam and found a small lesion on the anal canal wall. It turned out to be an early stage tumor, something that would have continued, growing silently had he not followed his gut instinct that something just didn't feel right. The same holds true for women. Vulval cancer is relatively rare, but becomes more common after age 60. In one of its earliest signs, a recurring echinnon or near the outer genital area, there may not be a lump, but the skin might begin to feel rougher, slightly discolored, or thinner than usual. Many older women assume it's hormonal or related to postmenopausal dryness, and sometimes it is. But if the itching is relentless, if it worsens at night, and if it doesn't respond to normal treatments, don't dismiss it. This part of the body is full of nerve endings. It's highly sensitive, and because of that, it often signals internal changes before more visible symptoms emerge. And whether it's a change in skin cells, nerve inflammation, or swelling in nearby lymph nodes, chronic itching in this region, especially when it's only on one side or focused in one small spot, can be a red flag. And yet, most people hesitate to say anything They fear embarrassment or they worry they're overreacting. But silence is far more dangerous than curiosity. Speaking up about an itch might just lead to early detection, better outcomes, and peace of mind. The most important takeaway, if the itch doesn't go away, don't assume it's normal. Let a healthcare provider take a look, because catching something early, even something as serious as cancer, often starts with noticing something small, something subtle, and choosing not to ignore it. Sign 4, localized itching on the chest or breast area. When older adults, especially women, but also men, notice persistent itching on the chest or breast area, particularly around the nipple or just beneath the breast, it can be easy to attribute it to sweat, a snug shirt, or even age-related skin thinning. But this specific area is one of the most overlooked spots where itching may signal something far more serious, inflammatory breast cancer or other underlying tumors near the chest wall. What makes this sign unique is that it often shows up before any lump does. The skin might feel warm, irritated, or tight. Sometimes there's a change in texture, slightly rough, thicker than normal, or with a reddish tint. But just as often, there's nothing to see, only a deep, persistent itch that never seems to go away, no matter what cream or lotion is applied. I recall the story of Ruth, 69, who noticed an odd itching sensation around her right breast. She tried switching bras. She tried different detergents. She even went without a bra for a while, thinking it was friction. But the itching continued, same spot, every day. When she finally went in for a checkup, her doctor noted slight skin dimpling and ordered further tests. What they found was a small but aggressive tumor growing close to the skin, surfaced without the typical round lump. Most people expect this is one of the reasons inflammatory breast cancer can be so dangerous. If it doesn't always follow the rules, it can mimic a skin rash, but it can spread quickly. And the earliest symptom is often not pain, but irritation. That's why paying attention to itching that doesn't move around, doesn't ease with moisturizers, and being focused in the same place day after day is so crucial, especially in the breast or chest area. For men, this can be even easier to miss. Male breast cancer is rare, but it does happen and often goes undetected because the signs don't match what most men think to look for. An itchy patch near the nipple, a small area of thick and skin, or a persistent twinge of discomfort under the chest muscle might not sound dramatic, but for someone in their 60s, 70s, or 80s, it deserves a closer look. And there's more. This kind of itch isn't always about cancer growing in the breast itself. It can also be caused by enlarged lymph nodes under the arms or just below the collarbone, signaling lymphoma or another nearby malignancy. So if the itch is accompanied by swelling, warmth, or even just a vague sense of heaviness in the area, don't wait. Early detection doesn't start with fancy machines. It starts with awareness, with listening, with noticing the quiet patterns that seem out of place. Because your skin can't speak, but it can signal. And this is one of the most important signals not to ignore. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Sign 3, itches scalp without visible flakes or dandruff. An itchy scalp might seem like one of those minor everyday annoyances, something you chalk up to dry weather, getting older, or using the wrong shampoo. For many older adults, it doesn't raise concern. But when it sticks around, especially without any flakes, redness, or visible irritation, It could be the first sign of something happening deeper beneath the surface. In fact, persistent scalp itching, particularly the kind that feels like tingling, burning, or crawling sensation, has been quietly associated early signs of blood-related cancers like leukemia, as well as skin cancers that form on the scalp. What sets this kind of itch apart is that it doesn't behave like a typical dry scalp. It tends to move from spot to spot, and no matter how many shampoos for scalp oils you try, nothing really helps. Take the story of Dave, a 73-year-old man who thought his scalp irritation was just a reaction to his hair products, or maybe the hat he wore every afternoon. He tried switching brands, going hat-free, but the itching stayed. Eventually, a routine blood test for unrelated fatigue revealed abnormal white blood cell levels. Further tests confirmed early-stage chronic lymphocytic leukemia. What's remarkable? That constant scalp, which was the only symptom his body had been giving him. And this is where things get tricky, because for many older adults, some degree of skin dryness or sensitivity is already common. So when a new itch appears, it often blends in with what already feels normal. But there's a key difference here. Cancer-related itching doesn't respond to typical skin remedies. It's stubborn, it lingers, it doesn't seem to be coming from the skin surface, but from somewhere deeper. And it's often accompanied by other subtle symptoms like low energy, unusual bruising, or just an unshakable sense that something's off. And leukemia isn't the only concern. Skin cancers, particularly on the scalp where hair is thinning, often start small, maybe a dry patch or a bump that itches in the same exact spot. It might look like harmless dry skin at first, but if it persists or becomes irritated for no clear reason, it's worth a closer look by a medical professional or dermatologist. Since the scalp is difficult to inspect on your own, ask someone you trust, a partner, a caregiver, or even your hairdresser, to take a look. If you've been dealing with a scalp, which that doesn't improve, and you've tried everything you can think of, don't just dismiss it, especially if it's been going on for weeks and nothing seems to change. Combine that with unexplained fatigue or anything else unusual, and that small annoyance could actually be your body waving a red flag. Because sometimes it's not the loud symptoms that matter most. Sometimes it's quiet, persistent ones, the ones we're tempted to ignore that. Tell the most important story of all. The sign 2, itching between the shoulder blades or upper back. Most people wouldn't think twice about an itch between their shoulder blades. It's easy to blame on a rough shirt tag, dry weather, or simply sitting in one position too long. But when that itch becomes constant, deep on the lending, and seemingly coming from beneath the skin, it could be a message your body is trying to send. And surprisingly, in some older adults, that message has pointed to pancreatic cancer. First glance, the connection feels unlikely. After all, how can an issue buried deep in the abdomen lead to an inch in the middle of your back? The answer lies in a silent domino effect happening inside. As tumors grow in the pancreas, they can block the narrow bile ducts that help flush bile from the liver to the digestive tract. When these ducts become obstructed, bile salts begin to leak into the bloodstream. Those salts don't just stay in the gut. They circulate, irritate, and eventually find their way to the surface, often targeting the dense nerve clusters located in the upper back. One woman, Linda, 70 years old, shared her experience with what she described as a strange, persistent itch. It wasn't sharp, it wasn't visible, but it kept her up at night. She changed her mattress, swapped out her laundry detergent, tried every cream in the pharmacy, nothing worked. The sensation was deep, like it was coming from the inside out. With no other obvious symptoms, she finally saw her doctor. Routine blood work showed elevated liver enzymes, prompting deeper scans. That's when they found it. A small tumor pressing against her bile duct. That stubborn itch, the one she nearly dismissed, turned out to be her body's only warning sign. This is why paying attention to where and how you've soured in its matters. It's not about overreacting to every little tingle. It's about noticing what doesn't go away. It's about listening when something feels off, even if there's no visible rash, no new product, no clear trigger, especially when it's paired with other subtle clues, like darker than normal urine pale colored stools or ongoing fatigue. As we age, our bodies speak more softly. A symptom might not scream in pain. It might murmur in patterns, like a quiet inch that always finds the same place. And when it does, ignoring it isn't strength, it's risk. Early warning signs don't always come wrapped in drama. Sometimes they come disguised as small annoyances. If you made it this far, it means you care. Drop a number 2 in the comments to let me know you're here and learning. And if you haven't already, make sure to subscribe and turn on the notification bell. We're sharing life-changing insights every week, because sometimes what saves life is in a diagnosis. It's a decision to listen sooner. Sign 1, persistent itching on the lower legs. When older adults start to experience a persistent itching on the lower legs, especially the shins and calves, with no rash, no dryness, and no new soap or lotion to blame, it might be easy to write it off as aging skin. But this very specific symptom has quietly shown up in many people diagnosed with blood-related cancers, especially lymphoma. That's not the kind of itch that comes and goes. It lingers. It often gets worse at night, and it doesn't respond to lotion the way dry skin does. The reason this happens has to do with how cancers like Hodgkin's lymphoma affect the immune system. These cancers originate in a lymphatic system, a critical part of the body's defense and drainage network. As the cancer cells multiply, they release inflammatory chemicals into the bloodstream. One of the most common side effects of these chemicals is a deep, almost burning itch that settles in the lower limbs. Even though the skin might look completely normal on the outside, the nerves underneath are being irritated from within. There's a man named Kevin, 75, who shared his story during a routine cancer awareness event. And he said his only symptom for nearly 6 months was an uncontrollable edema of front of his legs. His doctor initially thought it was eczema or maybe a reaction to detergent, but when blood tests showed abnormal white cell levels and further scans revealed swollen lymph nodes in his chest, the diagnosis became clear. The itch came first, he said, long before anything else. This kind of story isn't rare. And while not every itchy leg means cancer, the key difference lies in how skin responds or doesn't. If there's no rash, no new soap, no bug bites, and it's been going on for weeks, it's time to dig deeper, especially if it's paired with other quiet signs like night sweats, fatigue, or unexplained weight loss. For older adults, this kind of awareness becomes especially important. As we age, our bodies become less obvious in how they send distress signals. The pain might not come right away. The lumps may be too deep to feel, but the nerves still react and itch. Particularly deep, restless, unrelenting itch is often how that reaction first shows up. If someone you care about has been scratching their legs every night, applying creams with no relief, and wondering why nothing's working, Don't ignore it. Talk to a doctor. Ask about blood work. Mention the pattern, because sometimes the body whispers long before it shouts, and listening can make all the difference. Before you go, remember this. Your body doesn't always shout when something's wrong. Sometimes it whispers, and those whispers might come in the form of a stubborn edge showing up in the same spot, refusing to go away. You don't need to panic, but you do need to pay attention, because catching something early often starts with noticing something small. And if today's video helped you see things a little differently, don't keep it to yourself. Talk to someone. Share this video with a loved one. You never know who might need this message more than you think. And if you want to keep learning how to protect your health, make smart choices. And stay one step ahead. Hit that subscribe button now. We've got more life-saving insights coming, and I'd love for you to be here when they do. Until next time, take care of your body, trust what it's telling you, and thank you for being part of this growing community. We'll see you in the next video.